Good morning, everyone. Thank you so much for joining today. We have a really good, big group of folks here today, and so really appreciate your time. I wanted to say a few words to kick off the meeting. My name, again, is Olivia Alford. I'm the Deputy Director of Policy and Program for the Office of Main Care Services. Really excited that we've gotten to this point of this project. But I wanted to talk about this project kind of in the broader context as we launch into today, because we did have another session of this same material last week, and just wanted to note that, really setting the context is important so that we all understand where we are in this work and why this particular meeting is happening today. So there's been a whole lot of work over many, many years to talk about how Main Care supports and reimburses for a variety of services delivered in schools, delivered by schools, early childhood, and all of that work is ongoing and a great example of collaboration across groups and entities. What we're doing today is a very specific part of our work together, which is about looking at specific areas where Main Care is putting the question out there and putting service definitions out there for areas where we think we need to evaluate whether Main Care reimbursement needs to be revised or set in the first place for specific school services. So we're looking here today at areas that Main Care has identified that we want to ask the questions to develop rates for very specific services that either exist today and are reimbursed for in different ways, or aren't being reimbursed for today in different settings. That is the specific kind of context of where we are today. This conversation today isn't about the broader topics around policies and eligibilities for other things. It's really about the process here where Main Care is seeking to make sure that the reimbursement we have supports schools in delivering the services that we're talking about today. The few areas that we're going to talk about today, they're all kind of coming from different places. So I just want to say up front, we have these different kind of buckets of conversations that the team from Milliman, who's our partner in the rate setting process, is going to walk through. We're talking about a few these buckets of services throughout the presentation. You'll hear about school health related services provided by school health clinics that exist today and may be being delivered today. Things like psychological testing, outpatient therapy, general school nursing services, school health clinic services, things that exist today. And we're asking through this process and through your engagement to help set rates that appropriately reflect the work that you're doing in these areas. For some of these areas, it's pretty defined. Here's what we mean by psychological testing. Here's what we mean by outpatient therapy. Here's what we mean by general school nursing. But for other areas, it's not defined very well today, such as other services provided by school health clinics. So while some of the content today is really focused on specific service areas, some of it, what we're talking about today, is just opening up a conversation that's going to lead us through a different process to understand whether Main Care reimbursement needs to be changed and in what ways, to make sure we're meeting the needs for what you're delivering to Main Care members via school health clinic. So more open-ended, longer conversation, multiple steps will come in those areas that are less defined, whereas some of the more defined areas, we may be able to get to our rate faster. There's also some really exciting work the team's been pushing forward regarding early development support services. These are new services not currently reimbursed for early childhood health-related needs for children ages 0 to 5. That's a separate kind of category or bucket of services that we're looking to build a rate for, which doesn't exist today as a service, but really important to support young children. So I just want to lay that out there as these different kind of buckets, and we're going to try to use that terminology as we move through the presentation today. But this is part of a process, and again, a very specific part of the process, where we really appreciate your engagement in all aspects of this work, and the rates, as we know, are a critical piece of that. So I'll hand over to Jessica to kind of lay out the agenda and what we're about to go through, and then you'll see some very detailed information from Milliman that'll help you engage in this work around the rates. Thank you.
Hi, I'm Jessica Levesque. I am the project coordinator lead for school health related services, and we're really excited to have everybody with us today. And thank you for taking time out of your day to join us. Um, we just want to go over a couple of housekeeping rules. You'll notice that you should have a Q&A chat, Q&A feature, and we encourage you to, as your questions arise throughout the presentation, to go ahead and enter them into the chat. We have a time frame at the end of this meeting dedicated to answering questions. You will notice that your chat feature, if you can see it, should be disabled. It's too confusing to have both of them on at the same time. Everybody is muted upon entry. So how we would handle that is at the end of the meeting, if you should have a question, we'll ask you to raise your hand. We'll give instructions then. So we'll do that. And all this information will be saved on our rate reform website. And today's presentation, as a reminder, is being recorded because we will post that on our website and you will be able to review it at a later date. And we'll go ahead and get started on the presentation. So today's presentation, this is the second presentation. The first one we had, it was on May 27th, and it was in the evening. And so we wanted to make sure that we had a presentation also during the day to accommodate as many people as time schedules as we could. So today's agenda, as you can see, is going to be a very large agenda, and we'll get through everything that we are able to and answer questions. So we'll first do introductions of the Milliman team, the main team. We'll talk about the rate determination process. Then we'll have some school health related definitions and who are the eligible providers. We'll have an overview of what are the school health related and the school health clinic services. So we'll overview both of those and what the differences are. Then we'll talk about the EDSS, this new service that will be available. When we'll talk about the interested parties engagement and how that will occur, and the independent rate model, what we think will be, what we're proposing or think will be moving forward for the rate model. And then we'll have a survey demonstration. So this will be really important. We're recording this. You can use this as a tool later to refer back for the survey demonstration. Then we'll talk about next steps and and we'll have a period for comments and questions. Next slide, please. Okay, I'm going to go ahead and turn this over to Dennis to do Milliman team introductions.
All right. And thank you, Jessica. And yeah, just briefly, before I turn the presentation back to Jessica, I wanted to introduce the time to introduce our Milliman team. As Olivia had mentioned, we are supporting the rate setting component of this rate determination. So including me on this call is Ian McCullough, a principal and consulting actuary with Milliman. Ian provides project oversight and direction. My name's Dennis Finnegan, the project manager and engagement lead. We also have Jillian Zahner, a rate setting subject matter expert that oversees our analytics team, and Sasha Wildfong, a policy and services subject matter expert. We're looking forward to supporting everybody throughout this rate determination, and I'll hand the project presentation back over to Jessica.
Thank you, Dennis. So I'm going to take a minute to introduce who's working on this project from the main OMS team. So there's myself, there's Henry Eckerson, who is the Children's Behavioral Health Policy Manager, Trista Collins, who's the State Medicaid Education Liaison, and Dwayne Parsons, who's had a recent title change, but for the purpose of this, he is still helping us as a rate setting. So that is your internal main care team working on this. We also have Taylor Fay as your policy writer. Next slide, please. So I'm going to take a minute to talk about the rate determination process because this could be something new for a lot of you on this call, and want to take a minute to talk about what that involves. Next slide, please. The rate determination process generally goes something like this. It starts with an initiation notice, and in this case, the initiation notice was sent out July 2nd, 2025. Today, we're doing a kickoff meeting and an introduction to your survey that we're hoping you'll be able to participate in. So we also could have a period of time where we'll do some interested party engagement that could be meetings, but in addition to the survey. So we do know where we're doing some surveys for this particular study. There could be follow-up meetings to these surveys. So if we get a lot of responses to the survey and there's information that's conflicting, or we need some clarification and we need to do it in a larger group to make more sense of it, then we would pull another meeting together and kind of talk that through so we have a better understanding of that information. And there will be a second survey that goes out that Milliman will talk about later in the presentation. After we get through all of that, and there's some draft rate models to present with some draft rates, then we will have another notice sent out that will discuss the public presentation of those draft rates and models. After that meeting, you'll have an opportunity to have written comment, and then the department will respond to those comments, and that response to comments gets posted on the rate reform website. And then below at the bottom is just basically a different way to look at the process in a clearer way. Next slide, please. So the reason why we're doing rate determinations has to do with this standalone section of Maine Law, Title 22, MRS 3173-J, which we have had enacted since 2022. And it is comprised of, it sets up rules for us to have regular schedule of rate reviews and adjustments, which could include different things like COLAs and how often we review whether your rate is benchmarked or whether it's done by a rate study, for examples. It also, the process ensures that what we do is review our data against relevant state data, national data, Medicare, any other models, and see what makes the most sense, if there's a benchmark out there, and if not, then we move forward with the rate study. It formalizes a clear and transparent process for the rate determination, which is the process I explained on the previous slide. So it allows you to be involved in the process, and we explain it to you. There's also a Maine Care Advisory Committee specific for rate reform. And there's also a technical advisory panel that meets twice a year, and it's for the commission. The commissioner decides if we meet more often than that. So that's it in a nutshell, the high level things that involve this process. Next slide, please. Okay, I think this is where I turn it over to someone on the Milliman team.
Yeah, it'll be me. Thanks, Jess. All right. So, as we've mentioned, this rate determination process covers a wide variety of services, and so the first slides that we wanted to cover really are going to be trying to ground everybody in the understanding of definitions and eligible providers. We wanted to start with just three terms that you'll see throughout this presentation. The first is going to be schools. So schools are defined as a program that has been approved by the Maine Department of Education as either a special purpose private school or a public school, or a program operated or approved by the Child Development Services System as defined in Section 28 and Section 65 of the Maine Care Benefits Manual. We've also provided a definition of school administrative units, or SAUs, and those are public school districts that manage one or more schools within a defined area. And then also, as we've mentioned, school health clinics. And so school health clinics are SAUs that provide preventative, diagnostic, and/or therapeutic services addressing acute and episodic and chronic conditions. So again, we just wanted to provide really three definitions, three terms that you'll see throughout the presentation, and make sure that there's clear understanding of what we're talking about when we mention those. You're also going to see the word provider. And so, on this slide, we've provided an overview of who can bill and provide or render services under this rate determination process. And we do really want to stress that this slide is applicable to this rate determination and may be different for other rate determinations. So billing providers for main care school health related services are a program that has been approved by the Department of Education as a special purpose private school or a public school program. Rendering providers for main care school health related services are when the school or SAU employs or contracts with health professionals. When the school employs or contracts with staff who will provide the health services, the school can enter a provider agreement with main care and receive payments for covered services that they provide. We also want to note that there will be additional billing providers included in the EDSS section, and those are the new services that Sasha will be going over in the upcoming slides. So now we're going to move towards the school health related services that are under this rate determination. And there are two LDs that we wanted to introduce that are guiding this work. So there's main revised statutes titled 22313-J, which Jessica went over in detail, and then PL 2021, Chapter 227, to address health-related services that are required for children ages 0 to 5 to access their education. As we mentioned, this rate determination covers a wide array of services, and we're going to go into each one of these in more detail. So the first is psychological testing provided by a school psychologist, outpatient therapy provided by a school psychologist, general school nursing services, early developmental support services or EDSS, Ruby parent training, EDSS skill building service, and then other services that a school health clinic provides, including preventative, diagnostic, and/or therapeutic services addressing acute, episodic, and chronic conditions. And so over the upcoming slides, we're going to go into more detail about these services and any potential changes. So the first service that we want to cover is the psychological testing provided by a school psychologist. So the scope of services includes a clinical assessment of thinking, reasoning, and judgment, meeting face-to-face with the member, as well as time interpreting tests and preparing the report of test results. Services may also include testing for diagnostic purposes to measure a member's personality, emotions, intellectual functioning, personality characteristics, psychopathology through the use of standardized test instruments or projective tests. The anticipated new eligible provider includes school psychologists. So again, this is more of an anticipated expansion of eligible providers being a school psychologist. Qualifications for a school psychologist include school certified psychologists that meet the minimum standards. And those minimum standards include a graduate degree from an accredited program in school psychology that was approved by the National Association of School Psychologists, the American Psychological Association in School Psychology, or the department at the time the degree was awarded. They've also completed graduate work that is determined by the commissioner to be substantially similar to the programs referred to in paragraph A, or holds a valid license from the State Board of Examiners of Psychologists with demonstrated competency in the area of school psychology through training and experience. So as we move forward for the additional school psychologist services, this also includes outpatient therapy, which is delivered by a school psychologist, including individual, family, and group therapy that improves functioning, addresses symptoms, relieves excess stress, and promotes positive orientation and growth that increases independent levels of functioning. These are anticipated to be the new eligible practitioner qualifications that we stated on the last slide. The third service that we'll be looking at under this rate determination is a general school nursing service, and this is anticipated to be a new service. So the scope of service is anticipated for nursing services that align with the nurse's scope of practice and is outside of private duty nursing or PDN, which is currently covered in a school setting in accordance with the Main Care Benefits Manual, Section 96 for private duty nursing and personal care services. These services will be billable only by an enrolled school provider, and the eligible practitioners include a registered nurse, as well as an advanced practice registered nurse or APRN. The qualifications include a current state of Maine license as a registered professional nurse, Maine Department of Education certification as a school nurse, or meets the eligibility requirements, a minimum of a baccalaureate degree completed from an accredited college or university, and they hold a valid state of Maine criminal history record check approval. We also wanted to have a focus on the school health clinic services, which Olivia went in detail around trying to make sure that there is a kind of a clear understanding of what these services can include. So for the purposes of today's rate determination kickoff meeting, we are defining school health clinic or ambulatory care clinic is a school health clinic that performs preventative diagnostic and/or therapeutic services to address acute, episodic, and chronic conditions. The specific covered services for school health clinic services include, again, as we've mentioned, preventative diagnostic and/or therapeutic services for acute, episodic, and chronic conditions furnished by the clinic's professional staff. Supplies commonly furnished for these provisions or these services, and basic lab services essential for immediate diagnosis and treatment. On the screen, we've provided a list of the eligible practitioners that are either employed or contracted with the enrolled schools, and these include physicians, nurse practitioners, PAs, licensed clinical social workers, licensed professional counselors, alcohol and drug counselors, registered nurses, licensed clinical professional counselors, psychologists, respiratory therapists, nurse midwives, and other qualified staff. So under this rate determination, DHHS is going to be issuing a survey to help inform school health clinic services design and coverage of future services. So the survey really is intended to collect information to provide an understanding of current experience delivering school health clinic services. We're asking for school administrative units or SAUs and billing providers that are delivering and anticipated to deliver school health clinic services. This survey is not currently available. What Jillian's going to be covering is an Excel-based survey, which is currently on the Main Care website. This will be released at a future time in June, and interested parties will have approximately 2 weeks to complete the survey. So once again, this survey is not currently out. Both will be posted to the Main Care website, and the survey will be through Microsoft Form, and you'll be able to access this through a web link. And so it'll be more like a template with some open-ended questions for you to respond to. Within the survey, we'll include instructions and relevant definitions to try to help guide you through the Microsoft Form. And as mentioned previously, we'll also have an inbox to provide technical assistance if you need further support. So I'm now going to hand off the presentation to Sasha, and she's going to review EDSS services.
Hello, everyone. My name is Sasha Wildfong, and I'll be walking through EDSS, as Dennis mentioned. So these are the potentially new early development support services that will be covered, providing an overview. So to provide a background and purpose of the rate setting process for EDSS, the following slides will provide descriptions of a brand new set of services and credential currently in development. This information is being introduced to solicit feedback on potential rate based on the current design. And please use the service and credential information provided for the purpose of providing input on costs in the survey, assuming the service design is implemented as outlined. All interested parties will have the opportunity through a formal rulemaking process to provide comments on the newly covered service design and credential. So for early development support services, these are potential newly covered services which MaineCare intends to propose under Chapter 2, Section 106, School Health Related Services. EDSS would include 3 categories of covered services. 1, the screening assessment. 2, individual or group skill building services. And 3, parent training and support. These services are designed to support a child's development across cognitive, social, emotional, adaptive, communication, psychomotor, and physical domains, including vision and hearing, to promote each child's functional development and long-term outcomes. So we will walk through each anticipated covered service. Each session may include one or more of the following components. The first being screening and assessment. Providers must deliver screening and assessment services using department-approved, research-based developmental screening tools administered with fidelity by a qualified professional in collaboration with parents or caregivers. EDSS services are appropriate when screening shows developmental delay or risk of delay. Screening tools must be age-appropriate, culturally and linguistically responsive, valid, reliable, and administered by trained professionals or personnel. Providers must share results with the parent or caregiver and the child's primary care provider and the treatment team. The second component is the direct skill building for an individual or a group. So providers must deliver skill building services in conjunction with an evidence-based early childhood education model or curriculum based on the child's assessed needs and treatment plan. Approaches may include modeling, guided practice, task analysis, role play, visual supports, prompting and fading, positive reinforcement, and generalization strategies. The third component is parent training and support. So parent training and support services must use the research units in behavioral intervention or RUI training. To be an eligible EDSS service, or to be eligible for a service, MaineCare members from birth through age 7 must meet one of the following criteria. So a developmental disability or delay as documented by a physician, clinician, or other licensed practitioner of the healing arts within the scope of practice under state law, or children identified with developmental disability or delay or at risk of developmental disability or delay as indicated by department-approved developmental screening, or a child birth through age 6 who has a diagnosis from a physician, including a psychiatrist, of a specific congenital or acquired condition and a written assessment by a physician, including psychiatrist, that there is a significant probability that because of that condition, the member will meet the functional impairment criteria above later in life if medically necessary and supports are not provided to the member. Or a child age birth through 3 who's at risk of experiencing developmental delays because of a biological or environmental factor that can be identified and documented, including low birth weight, respiratory distress as a newborn, lack of oxygen, brain hemorrhage, infection, nutritional deprivation, a history of abuse or neglect or homelessness, or being directly affected by substance use disorder or withdrawal symptoms resulting from prenatal drug exposure. So this slide provides an overview of the new credential for a developmental specialist. MaineCare and the Office of Child and Family Services have established a new state provider definition for EDSS service delivery to address workforce capacity and expand access. Developmental specialists can qualify through one of the following pathways. 1, through Maine Infant Toddler Credential or Preschool Credential or Family Childhood Credential or a Child Development Associate, CDA, and Inclusion Credential, ages 3 to 5, or Associate Degree in Early Childhood Education, or bachelor's degree in early childhood education. Or endorsement 282, teacher of children with disabilities, birth age through 5, or certified behavioral health professional with OCFS approved training in developmental screening, family engagement, and IDEA Part B and C, plus one of the following: a bachelor's degree, 90 credit hours in a related field, or an associate degree or equivalent with 2 years of relevant experience. Or an educational technician 3 with OCFS approval training in developmental screening, family engagement, and IDEA Part B and C. So provider and program requirements. To deliver EDSS in a licensed childcare setting must meet background check requirements, and must also be registered in Maine's Professional Development Registry. Providers must maintain OCFS approval to deliver EDSS services. The eligible provider types include licensed mental health agencies, licensed child care programs, state independent educational units, and other approved providers. Supervisors must be developmental specialists with a minimum of 5 years of experience in early childhood education. Delivery standards for EDSS include: 1 developmental specialist can deliver individual services per session. And for group services, 1 developmental specialist can serve up to 2 children according to established ratios. A parent or caregiver must take part in each session delivered in a member's home, and a parent or caregiver must take part in 1 session weekly in sessions delivered in a child care or preschool setting. So the EDSS Ruby training is also referred to as research units in behavioral intervention, which is a parent training program focused on autism and behavioral intervention. It is designed to help parents and caregivers manage challenging behaviors in autistic and developmentally disabled youth through evidence-based practices. The program is grounded in applied behavioral analysis, or ABA, and positions parents as critical agents in the intervention process, providing them with strategies to decrease problem behaviors. The eligible practitioners include someone who has completed the Ruby training program by a certified trainer. And also the qualifications include the completion of a Tier 1 Ruby training. EDSS skill building is a service for members 7 and under who have or are at risk of developing a developmental disability or delay. The services are intended to retain or improve functional abilities that have been negatively impacted by the member's cognitive or functional impairment. Services focus on behavior modification, behavior development and/or acquisition, improvement and/or retention of developmentally appropriate skills. The eligible practitioner is a developmental specialist, which the credentials that were previously reviewed, and you can refer back to those qualifications on that previous slide. Now I will turn it over to Jillian, who will walk through the survey, which will be used to gather further information on these services to help inform the rate setting process.
And I was just going to jump in before we do that. I just wanted to answer one of the questions that came up in the chat, because I think it's a great question. It talks about kind of like the scope of what we're presenting today and what we're not talking about today. So I wanted to just address the question on the call. So the specific question was about the rate for, or if we go back, someone who's switching on the slides could go back to the school psychologist. I think we could pick either one, the testing or the outpatient therapy slide. And the question was, the standards that the provider qualifications that were put on the slide, why is that what we're talking about versus talking about master's level clinicians that can deliver the same service? And that's a great question. So the reason that this presentation today is focused on these school psychologists, which would include master's level school psychologists that hold the DOE certification. But the reason we're not talking about master's level clinicians more broadly is because we already have rates set for those services. So again, focusing today on where we really need to talk about building new rates to adequately support specific services and not talking about the broader set of school-based services or school services where we already have rates. So that's kind of the context of why we're specifically trying to design a rate for this particular qualification and this particular service. But that was a great question that I just wanted to raise up because I think it could apply to several things in this presentation. Why are we focusing on just this? Well, because this is a rate setting process. But these are good questions, and I encourage people to put their questions in the Q&A if others come up. And I'll say, just because we also, for the new service, EDSS, that was just introduced, or for what we put forward with this example, you'll see as the Milliman team goes through this survey that there's a lot of opportunities for you to provide feedback on the assumptions or the information that we're putting forward today. So you have plenty of opportunity and spaces within the survey to say what you think about any of these components, this service design, because it comes through in the questions we're asking about building a rate.
Okay, I'm going to talk through first the interested parties engagement on the next slide. So the provider survey that I'll be talking about is separate from the survey that we talked about a little bit earlier. We're really looking for feedback, which is a critical piece of the service design of the rate determination, and your feedback will be used to help inform the rate assumptions that will be used in these service rate builds that we're talking about. The purpose is to collect baseline data to help support an understanding of the actual and anticipated provider costs to inform those rate assumptions that I mentioned. Participants will include school administrative units, childcare agencies, or other agencies delivering and anticipating to deliver school health related services that we've discussed that are included in this rate determination process. The survey was released on May 27th when we had our first meeting, but the due date is June 19th, so that's a little more than 2 weeks from today. So everyone will have 2 weeks to complete the survey. We're requesting information on service delivery costs, including those related to direct care and clinical care staffing and supervision, billable and unbillable time for services, employee benefits, administrative costs, and transportation costs. The survey is in Excel, and there's a web link available on the main care website where you can access the survey. And instructions, there are not separate instructions, there's instructions embedded throughout the Excel document. So before I get into sharing the survey itself, we'll talk through the independent rate model and an overview of how the rate modeling will be done. So the independent rate model, which is the method that Milliman typically uses for these type of rate determination projects, is a ground up approach. So the rates in this case are built from the ground up. They're based on a sum of independently determined rate inputs and components, which those are the assumptions that we talked about and are included in the survey. And these inputs are based on expected resources required to provide the service, and they can be customized based on information that we're able to receive from providers. This is a commonly applied rate determination method. Many states use the independent rate model approach. It's also an acceptable method for rate determinations from CMS. Some benefits of this approach: it provides transparency as to the reasonable costs required to provide the service. So it shows specifically like the independent components that are going into building the rates rather than just a composite rate. It also focuses the interested party dialogue on measurable and objective rate components. Again, rather than just the rate itself, we're looking at the specific components going into the rate. which also supports regular updates of the rates and modification efforts when the components are separated out in that way. It also facilitates comparison of actual costs and provides standardization between rates for different services. And again, it's developed independently, so it's not tied to historical costs. It can be based on cost assumptions for the future. So the independent rate model framework is a flexible framework that can be reflective of differences in rating methodologies and service standards. This is the general framework that will be used for this rate determination. So the unit service rate is equal to 4 primary components. The first of those components is the staff and supervisor salary and wages. So this is including assumptions around direct and indirect time that staff are spending on services, the wages of those staff, any additional PTO and training time that those staff may be taking, overtime or on-call costs, and then also supervisor ratios, so understanding who's supervising the staff providing services. The next component is the employee-related expenses. So this is including taxes and fees that are related to the staff from the first component, and also employee benefits. So things like health insurance, retirement benefits, dental insurance, any kind of employee benefits that are being provided. And then transportation expenses will also be considered. This is meant to include mileage that is paid to employees for use of their own vehicles in order to provide a service. So, for example, traveling to a client's home to provide a service. And then finally, administration, program support, and overhead. This is kind of a catch-all component. It's really all other operating expenses. So things like management, staff, accounting, legal, IT, those sorts of things. So in terms of the data sources that may inform the rate buildup, the Bureau of Labor Statistics contains data on wage amounts specific to Maine and also surrounding states by different occupational codes for different job titles. It also includes information on workers' compensation costs, retirement benefit costs, and then health, dental, vision, and life insurance rates as well. The Internal Revenue Service includes information on standard mileage reimbursement rates and also the employee-related taxes, so the FICA percentages and limits and FUTA taxes. Also looking at rules and regulations, so published policies and guidance by the state. This includes the Maine Paid Family and Medical Leave Regulation. And then interested party feedback. So that's what we're talking about here today, collecting the survey data and other feedback from interested parties to help inform the rate assumptions. All right, so I will share the survey now and do a brief walkthrough of how the survey works. Okay, can I get a nod? Everyone can see my screen okay? Okay, thank you. All right, so starting off, just the instructions tab. I won't read through all of this, but this gives a brief overview of the survey. I do want to call out some of these bolded items here. In the second paragraph, I want to note that we're only asking for one response from an administrator, so a superintendent, school business officer, or special education director. The reason for this being the administrator is being asked specifically to provide information on staffing and staff costs and wages and those sorts of things. And so we're really only expecting one response from a school administrative unit, childcare agency, or a different organization for those costs. However, the organization in total can submit multiple surveys. So, for example, service providers can submit a survey. For example, a school nurse may want to submit the survey to just provide information on the school nursing. And that is expected and okay to do. Also mentioning that throughout this workbook, and I'll talk about this as I get to the other tabs, there is special formatting going out that grays out questions that are not expected to be answered based on your role or based on a selection to a prior question. I do want to bring up, I understand a lot of schools may use the Google Suite, so may use Google Forms instead of Excel. It's possible this formatting will be removed if the file is transferred to Google Forms. So just be aware that you're not expected to answer everything. So answer what you can if that does happen. And as far as we know, it's fine to put the survey into Google Forms and then submit it to us using that. And if you have any issues with that or accessing the survey or anything, we do also have an email noted up here in row 5 and row 6 as well that you can contact with any questions or concerns, and we can help figure out how to get you access and to the survey. So moving on, I won't talk too much about this tab, but there is a glossary tab in alphabetical order that contains definitions to many terms used throughout the survey that can be a helpful reference if there's anything that you're not sure what it's asking for. Tab 3, which is the information attestation. This tab is pretty important. We're asking for general contact information so we can contact you if we have any follow-up questions on the survey. And then also this is where you would select in question 3 your role. So the choices here being if you work as a staff for an early childhood care provider, if you're an administrator, or if you're a school health related service provider. So a nurse, psychologist, etc. And that's important because that limits the questions, as I mentioned, so that'll gray out questions that aren't applicable to your role. I have it filtered right now to just all other interested parties because that allows us to see everything. So if you are interested and want to see all the questions, you can choose that option, and that will remove all limitations. And then also the provider services, again, there's drop-down options here asking if you currently provide this type of service and are able to provide information, or if you don't, and that will limit questions as well. So moving on to the staffing, this tab specifically lays out different types of staff and provider types that we outlined. So for example, here on the screen, you can see school psychologists. We do have several of those staff split up based on credentialing type. So there's a master's degree school psychologist versus a doctoral school psychologist. This is primarily so we can understand differences in wages and potentially other items. You'll see throughout the survey we have listed preliminary assumptions where available, and we've also provided an example of ways that you could provide feedback, and then we're asking for feedback in the green cells on any of these preliminary assumptions. Some of them we don't have a preliminary assumption, so we're really asking providers to provide input on what a reasonable assumption should be for those things. I do want to mention too, just at the bottom, there are a few additional questions primarily related to the credentialing. So for example, again, these psychologists were asking what percent are master's versus doctoral, and similar questions for some of the other staff types included as well. The next tab asks for some information on benefits, so employee-related expenses. Laid out pretty similarly to the prior tab, we're asking for feedback on the preliminary assumptions. A few of the cells are grayed out here, and that's because these are either federally or state mandated percentages or limits, so not asking for any feedback since those are set assumptions, but we wanted to include them in the survey for your reference so you know that they will be considered and included as part of the rate determination process. All right, and then moving on to the one of the service specific tabs. So you'll see there's 6A through 6E. They lay out very specific questions to the service. And for example, the psych testing, the first question is asking what types of tests are administered. And you'll have to scroll to the right to see all of them. There are quite a few. And this is where I talked about the graying out. So if you say, yes, this is provided, then there's several follow-up questions specific to that type of testing, versus if you were to select no, then those would be grayed out and you wouldn't need to answer. If that sort of formatting is missing, I would suggest just filling out whatever questions you can. So if the answer is no and you're unable to answer all these other questions, that's perfectly fine, and we will work with that. And then I won't go through all of these questions, but if you get to any question, if you're unsure what it's asking, please feel free to reach out to the inbox that I mentioned before. All of these tabs are pretty similar, so again, won't go into too much detail. I will call out the school nursing is, again, similar to the psychological testing, where you have to scroll to the right. We're looking to collect information on the specific types of nursing activities that may be provided. And then the EDSS skill building tab and the EDSS Ruby parent training tab. Again, pretty similar layouts to the prior ones. Tab 7 is kind of a free space. If you have any additional information you want to provide, but you didn't have the space or the opportunity to provide that information on the prior tabs, please provide that information here and we will take that into consideration. And then the final tab that I'll really talk about is the survey feedback. This is meant to more so be if you have any feedback on areas for improvement in the future, for making surveys better or easier to use, any feedback is appreciated. And that I will stop sharing there. And we can go back to, I believe, next steps.
Yeah, I'll bring that up. And then one thing I did want to call out, I saw a question and then from Nicole and Olivia, I know you responded to it regarding if we wanted to report something like the limited number of psychologists within Maine. What Jillian had up on slides, or sorry, worksheet 7. And so that's kind of broken up by area. So if you feel like there's not something that's captured that you feel is important to report or would help the rate determination, you can always use worksheet 7 to report information like that. So I just wanted to make sure I brought that forward.
Right. Yes. So there are several things I'd like to talk about. Is it okay to do now, Jessica? Sorry, before are we at the part? Okay, go through some Q&A. Okay. Is that right?
Is that sorry, did you say, do you want to touch upon some questions now, or do you want us to wrap up next steps pretty quickly?
Oh, okay. Yeah, sure. Go. Yeah, you next step, and then we'll do Q&A after that. Thanks.
Okay.
Okay, so yeah, just some quick next steps. So today we had our kickoff meeting. The provider surveys have been distributed and are available on the main care rate system reform webpage. Just a reminder to submit those completed surveys to the main care rate determination Milliman email on the slide here. It's also in the instructions in the survey by June 19th. You can also use that email to ask any and all questions. We'll be monitoring that regularly. The school health clinic services survey, which is separate from the survey I just shared, will be released later this month. And again, any questions can be emailed to the main care rate determination email. And then later this summer, we will evaluate and follow up on survey results once those have been received. So I believe now I'll pass it over to main care to facilitate the Q&A.
Hi, everyone. I'm just going to say a couple of things before we address some stuff that was put in, some questions that were put in the Q&A throughout the presentation. So first, I'd like to thank you for participating with your questions throughout the presentation, and we look forward to additional questions that we've saved this time for at the end. I just wanted to talk about the housekeeping of how we do the Q&A part of this. So in order to be called upon, please raise your virtual hand. So you'll see at the bottom of your screen, you can raise your hand. We will call on you by the participant name that we see on the screen in the order that the hands are raised. Once we will ask you to unmute yourself, so we'll allow you to, we'll give you the permission, you'll unmute. Once you unmute, it's helpful to us if you can begin by stating your first and last name and the organization that you're a part of. And then I just want to put a plug in now for in the chat. I'm hoping you're seeing that we have put the link to the main care rate system reform site, which the first presentation is already posted at. Some notices are posted where you can click to the survey link. Today's information will also be posted there once we get the video. We've also posted in the chat how you can sign up for notices. This is how you get all of our information. So it's super helpful to sign up for notices for studies if you are not currently signed up. And I'm going to also post in the chat the email for, even though you'll have it in the survey and everything, just another place where you'll have the email to send your follow-up questions on the survey or anything else for today. So that being said, I'm going to turn this over to Olivia to address some of the Q&A that we had.
Thanks, Jessica. Yeah, so we'll do some quick Q&A because there's some commonality of some questions, and then we'll go to the hands in the room, virtual room. So one of the things I wanted to cover, just as a general several of these questions, today we're not focusing on what a future proposed Section 106 policy will include, or questions about anything related to the scope of that rulemaking. That's not because that's not important. It's very important. And that's something that we're actively discussing. But what we're focused on today is specifically setting the rates for these services. Also want to say that nothing that we're presenting today changes anything about what is currently covered in any other section of the main care benefits manual that already exists today. This is really, again, trying to hone in on specific areas where we feel like we may need a rate to be set differently for either an existing service or a new service. All of it, though, clearly feeds together and is part of the puzzle for determining how best to proceed with the Section 106 rulemaking and to proceed with any other impacted section of policy. We had an idea raised in one of the questions about the service being also applicable in another area. So those are all valid comments, but we won't be speaking to any answers to those today. That's an ongoing conversation, and you will see future engagements around that when we get later on in the process. And of course, with any of these services and with any rulemaking, including the introduction of a Section 106 school-based services rulemaking, there would be the full process where formal comments come in as well. But again, much more engagement before we get to that point, but it's definitely a high priority and clearly related. So several of the questions kind of get into that topic area. We won't be addressing those live today or in follow-up today about these rates. Also, like hearing you all on the deadline, certainly open to removing the deadline. We wanted to make sure we held these meetings during the school year, including like an evening session for those that was easier for them, and then a daytime session, like Jessica said, that was maybe easier for more people. So wanting to give all the opportunity for engagement, and we do anticipate, especially because we have these two kind of surveys, one being more concrete buckets of services and one being less concrete, more exploratory, that we will have future engagement opportunities, either one-on-one or in group settings. There's also several questions about the EDSS service. While I'll still continue to go through those with the team, and we may be able to answer some specific ones, you're probably going to have other questions that come up and that are really helpful questions that you think would be important for main care to articulate at this time, or as we're setting rates, and certainly as we're developing policy for these services. So when Jillian walked through the survey, there's those buckets or those blank text boxes. Just put them all in there. We're reviewing every single survey response. So if you need to know specific information to know whether you would want to deliver the service or whether the rate's adequate to deliver the service, like if we've missed something, we want to know at this point in the process, because then when we take it back and we come back with the proposed rate, we will articulate that, and then you'll be able to respond again to like a specific proposed rate to see whether we've captured the need appropriately or not. And then we'll revise it again if we need to and come back with another rate. So that's the process. So please, if we don't answer your question today, still ask the question in the survey so we can make sure that the proposed rate reflects what it needs to reflect. I think that was like the big questions. Again, we'll still scroll through these, but oh, and sorry, well, one more thing, just this last question that came in, which is probably related to EDSS from Michelle. The question of like what is the unit of service or how will this rate be constructed is also not yet determined and part of this process. So for school health clinic services or EDSS or even school nursing services, that's part of this process, is to decide, should this be a 15-minute rate? Should it be a 30-minute rate? Should it be a daily rate? Should it be an encounter rate? All those options are on the table at this point in the process. And we will present back what we think based on the data makes sense for a billing unit, but that's also up for discussion as we go through the process. All right. Jessica, do you want to lead going through the hands? It might only be one right now, but.
Sure. Nancy, you should be able to unmute. Did we lose her? I'm not seeing Nancy.
Did I unmute?
She moved. Oh, yeah.
There you did.
Now.
Yes.
Just
okay.
now.
Yeah.
Yeah.
Oh, good.
Okay.
All right. I said I really appreciate the EDSS service. I'm really excited to see it happening, and I appreciate this presentation. I was wondering, have you looked at and have you considered how we're going to be able to crosswalk, or who we're going to crosswalk to after EDSS doesn't exist, to be able to ensure continuity of care for who the provider is afterwards, especially because this is really a lovely DD service as well as early childhood service. So thank you.
Does anyone want to answer that live, or do we want to take that back with this kind of, there's a whole set of EDSS services, which you might want to take back as lots of thoughtful questions. Okay, we'll take that one back. Thank you for asking that.
Okay. If anybody else has any questions, please raise your virtual hand and we'll call on you. I know it was a lot of information. And maybe Olivia answered some of it at a higher level that maybe was on everybody's mind, but just know that this isn't your only opportunity. And if you want to go back and watch the May 27th recording, you want to watch this recording when it's available, when you're filling out the survey, if that's when the question comes to you or something specific, please do ask. Milliman will be happy to answer information if you email myself or I will get it to the right person. We want to answer your questions because there's a lot of different services in here. And like Olivia has said, this is how we're deciding and what we consider when we're moving forward with the rate. And while I'm waiting to make sure we have no more questions, I just want to say that today's PowerPoint presentation and the May 27th PowerPoint presentation are identical. So you would only need to want to review one, although you may want to look at the other recording. They're not exactly the same depending on, the material's the same, but there could be like a question or something that came up. So that would make this recording different than the May 27th one. So it's worth doing both if you have the opportunity. I'm not seeing any more hands raised. I do appreciate everybody taking the time to join us today, and we're really excited to have such great participation for this study, and we look forward to further communications and responses and working with you as we go through this study. Olivia, do you want to say something?
Well, yeah, I was just going to ask. I'm sorry. I mean, and I was typing, so I might have missed answer to this. But one specific question was, will the participants here be emailed the rate study survey, or did they have to actually see the e-message? And I think I'm not sure where everyone works here, but certainly we've been trying to push out the information. So if you yourself aren't receiving the e-message, that we hope you get it through another partner who is helping us push out information. But is that right, that it's coming out via the e-message and then look for that to be shared?
Yes. So there's the other way you can access it is that's why we post the main care rate system reform link in the chat. Hopefully everybody can access that. If you click on that and then you go to the notice that's in there from the follow-up meeting from May 27th, and there'll also be one for this meeting, you can access it through clicking the link in that notice. So you won't be getting an email based on your registration to participate in the survey. But if you've signed up for the e-notices, when you receive the e-notice, there'll be a link you can click to get to the survey, but we post those notices on that website that we put the link to. I hope that makes sense. And anybody can forward the link to anybody or the notice to anybody too. So please share it with anyone you feel aren't getting the notices that should be filling out the survey. I know Trista's been doing some outreach as well. So
it looks like someone is saying this might have been something you all know about, but the survey is locked. It says the survey is currently locked. When will it be unlocked?
Okay.
Yeah, from our understanding, the survey should be accessible. I think some people are having a hard time with the link. If anybody emails us, we can just send out a direct copy of the survey, and so we'll get it right to your inbox. And so that can be sent to the email address that Jess put in the chat, which is the main care _rate_determination@milliman.com. And then we'll get out that hard copy for you. And generally, if anybody has any issues accessing the survey or has technical assistant questions about it, that's going to be the same email address, and we'll provide quick responses for you.
And thank you for asking that question because I'm sure others are encountering that as well. I don't see any hands raised. Are there new questions in the chat, in the Q&A?
I just want to reiterate, it's hard to keep up with the Q&A, but specifically regarding EDSS, and I'm happy if we want to go back through the slides, if that's helpful. I think some of it too is like people are, they can't control the slides right yet to go back, although they are posted online. But the questions about why certain standards were called out on the slides, questions about things that weren't called out on the slides, or opportunities to change what was called out on the slides. Again, I think this is an iterative process. We're excited about this new service. We think it's an important service, and there will be several rounds of figuring out if we've gotten the standards and qualifications right to actually result in meaningful impact to families and children's lives and in the school setting, early childhood setting, I should say. So while we can't answer all of your questions, we do want to hear at this point and throughout the whole process whether you have feedback about any of the requirements that we put forward. So use those text boxes now. We will review them. If we want to make a change at this point in a standard or qualification, we'll do that when we come back and present something new to you about the draft rates. It may be that we still believe something we put forward is the way to go regarding a rate setting, but we'll have more opportunities for conversations about that all the way through this process until a policy is adopted. It's interesting when we have new services that we're putting out there, this happens in all areas, where it is hard to set a rate for a service that hasn't gone through the full process, and also for one that hasn't already actually been delivered in the real world in the way that we're describing it. So it is a challenge, but it's also necessary to have rates in place before you can propose a policy. So this part does have to come first in order to make sure we have the appropriations we need and the policies in place. So it's a process we're being very thoughtful about, but we welcome you to ask all these questions right now, and we'll be continuously reviewing them.
Okay. I agree. It is a struggle sometimes. It seems uncomfortable for everyone. If you're feeling that way, it's a good way for Olivia to explain it. Not seeing any more hands raised. I'm hoping you can access the chat with our links, and please do know we do want your questions, and we're very excited for everyone's participation. And forward it to anyone else who may need to fill out the survey, and reach out to the email address, my email address, if there's anything else. I think that's it for today. And again, we can't thank you enough for your participation. Have a great day, everyone. Thank you.